Clitoral adhesions. What's the prevalence and how do they affect women's sexual function? Stick around. Hey everybody, welcome back to another episode of Just a Tip with Dr. Vic slash Sex Nerd Podcast. My name is Dr. Victoria Hartman. And today what I'm going to be talking about is clitoral adhesions and the prevalence of them in one particular sexual medicine practice. Now, why are we talking about, well, before I get to that topic, let me get you guys caught up on where everything else is. So what I've been really super busy doing is finishing the first draft of the manuscript for my new book, which you can see right over here. I've talked about it before. It's called The Sexual Art of Serial Killers. And what I've done in that book is, well, a lot more than just review the sexual art of serial killers, hence the name of the book. But I sort of go into, what does art mean to us and what does that mean in terms of someone who has committed these violent offenses? Is it just art, or are we delving into the mind of these people a little more in depth and perhaps through psychological examination? Or is it a good addition to psychological examination? Or is it just scribbles on a piece of paper that they do because they're bored while they're in prison? I also go into a diagnostic chapter that where I use my tool, the classification tool that I and another co-academic developed. And we do a classification of each of these individuals. Once again, to reiterate that the tools that exist out there are inadequate and why. And I would even argue that ours is inadequate, that ours could be improved. So why are we so religiously adhering to the current tools that are available out there from Agrawal and Rosman and Resnick? Like, why are we so stuck on that instead of improving it? And it's not just us that have developed other tools. There are other scholars that have too, that are just as legitimate and add just as much breadth to the diagnostic tools that are available to, say, criminal or criminological investigators and profilers, right? So there's that. Okay, so yep, that's the book, and the first draft is done. It's going to be going to my reviewers pretty soon, and then I've already got a formatter ready to go. It's just a matter of getting it finished. We're going to have, oh, and I'll add this, going to have a book release party on August 31st of this year at the Erotic Heritage Museum, along with dun, 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 our Blacklist exhibition, freak show, and concert. All of those things right here are all going to be going on at the same time. It's our one big event of the year on August 31st. And my book is going to have a book release party on that night. So I hope you guys can attend that event. Okay. So so that's what's been going on, and that's what's been keeping me super busy at the museum. So, okay, so what are we talking about when we talk about clitoral adhesions? Well, according to these scholars, they added a paper to, let's see, the 19th Congress of the European Society for Sexual Medicine, Female Sexual Health and Dysfunction. And what they did is over the course of, let's see, from 2007 to 2015, they took vulvoscopic photographs in their sexual medicine practice. And those photographs were reviewed by two independent reviewers and evaluated for the presence of clitoral adhesions. What are adhesions? Beneath, let's see. So a clitoral adhesion generally often manifests as several millimeter sized keratin pearls that are lying underneath the adhesion. So the adhesions themselves are the clitoris. You can't pull the hood of the clitoris back far enough to see its ridge. And when there's adhesions present, you can't pull that clitoral hood back far enough to see the ridge of the clitoris. And what tends to lie underneath those adhesions, in other words, the inability for that clitoral hood to be retracted, are carat or pearl size, or what are they? Keratin pearls that they're lying underneath the adhesions. Now, what do those keratin pearls cause? Well, they can sometimes be associated with decreased sensation in the clitoris, muted orgasms, small fiber sensory neuropathy of the clitoris, leading to some of the most common complaints that women have, which are genital arousal disorder, uh, lack of orgasm, or genital pain. Okay. Now, um, so in this particular clinic, this retraction of the clitoral hood is common practice because apparently they see a lot of women for sexual dysfunction. Okay. So one of the things that they noted is they did 1,261 vulvoscopy photographs, and 767 of those photographs were considered adequate. So a sizable amount of photographs. Clitoral adhesions were suspected in 175, so 23% of those 1,261 photographs were seem to have the presence of clitoral adhesions. Okay. So a 23%, 1 in 5 women may present with clitoral adhesions to their gynecologist if they are complaining, or maybe they're not complaining, about sexual dysfunction of some kind, genital pain, etc. And their argument in this brief paper, or this brief submission that they had to this World Congress, or I'm sorry, Congress of European Society of Sexual Medicine, is to advocate for other medical health practitioners, especially gynecologists and those who treat or provide medical services to people with, vaginas and clitorises, is to check for clitoral adhesions. Now, I can say, not that I've presented to, actually, I take that back. And I talked about this several episodes ago where I had gone to a doctor because I had pain, and it ended up being an undiagnosed, now much more common bacterial infection called Mycoplasma hominis and uroplasia. It's much more common now. People are talking about it way more now, but um, that did cause sexual problems, but it was because of the pain that was associated with the, my internal bits and pieces, not anything related to, any external parts. So this isn't something that's talked about, though. I can't recall one. I've seen 18 gynecologists and obstetricians in my lifetime. Not one ever even performed a clitoral examination to see if there were adhesions present. They just didn't do it. And if we have women and people with clitorises who are presenting to their doctors and saying, I'm having genital pain, I'm having muted orgasms, I'm having problems with pleasure or with sexual enjoyment, this is something that they're recommending medical practitioners perform on people to see whether or not they have clitoral adhesions, because according to their research, 23%, or more than 1 in 5 women, have clitoral adhesions, and that could be something to consider. Now, they don't actually talk about how to solve the problem of clitoral adhesions, and that would be something I'm curious about. Well, if someone's presenting with clitoral adhesions to their practice, what's the solution? How do you solve that problem? Right? What do we do if someone presents with a clitoral adhesion? Does that require surgery? Is it something that can be taken care of in office? That also highlights, though, that we need to be able to talk about these things with our doctors. And I know when I was asked to, there was the Nevada Cancer Center here in Las Vegas. There was the head of the psychology department there, or psychology services there, wanted to bring me on board specifically as a sexologist although here in Nevada, there's no licensing board for sexologists, so they couldn't bring me on board under someone else's license, unfortunately. The psychologist that was, this was like 15 years ago, the psychologist that was on staff there said that the attending physicians were so uncomfortable talking about sexual issues and sexual functioning that he felt it was important to bring a professional in, someone who studied sexuality specifically, like a sexologist like me, to work with clients to help them with sexual dysfunction because it is so common after things like hysterectomy, cancer treatment, etc. Um, uh, I have to wonder if anyone who presented to that practice or that cancer center after their surgery, whether or not any of the doctors even asked themselves whether the patient was also dealing with clitoral adhesions. So I'm curious, like, I wonder if even my current doctor, well, has ever actually asked any of his patients what kind of sexual functioning they've had and examined the clitorises of their patients. Because if adhesions are such a problem and so common, why isn't that being discussed more often or part of a natural sort of annual exam? How's your sexual functioning? I've had one doctor, one, who's asked me that question. How's your sexual functioning? Other than that, never one, never, unless I went to them with some kind of issue. Mm-mm. So interesting research. This was done in 2000. I believe this was written in 2017. So I wonder what's been done since then. So today we've talked about something unusual that I haven't talked about before, which is clitoral adhesions. And if you are someone with a clitoris, I would definitely suggest bringing it up to your provider if you're, especially if you're dealing with some kind of sexual functioning. And I would also suggest that sexual health counselors ask their clients who are coming in with pain concerns, clitoridynia, vaginismus, any of these like sexual pain complaints, whether or not they have had an examination by their medical provider for clitoral adhesions, because that might be part of the issue. All right, everybody. Well, that's going to do it for me today. I am super excited about my book release. If, like I said, the official book release party is going to be August 31st, 2024 at the Erotic Heritage Museum. What else is going on that night? The Blacklist exhibition, freak show, and concert. And I will, after the video, I will post the ad that we have running at the museum for the different performers that are going to be there. And actually, we're expanding on that. Or maybe I'll just play it right here. And so I'm super excited. The bands that are signed are Poon Tickler, Chasm Lurk. The Poon Tickler is from Las Vegas. Chasm Lurk is from Salt Lake City. And I believe Weregoat is based in Seattle, Washington now. So those are our three musical performances. And then we have Ozzy Blood. And he is a Vegas-based freak show performer. And the museum has known Ozzy for a long time. He was a part of a show actually called The Freak Show way back during the before four times of the pandemic. So it's just gonna be and the I'm not gonna reveal who the main artist is yet. We're preparing that. And we also have a burlesque show that's going to be part of this as well. We are still finalizing the details on that. So there's all kinds of stuff that's coming. You're going to be told about all kinds more stuff. But for now, I will leave you and I hope you have a wonderful week and I hope your March ends great. And I will see you next time right back here on Sex Nerd Podcast. Just a Tip with Dr. Vic. Bye.